Hi, I'm Dr. Walt, the family doctor.
Hi, I'm Dr. Guy, the dentist.
And I'm Dr. Pat, the eye doctor. Join us, along with Ryan, as we take you on a visit to the doctors. Watch Dr. Walt, the family doctor, give Ryan a physical. And watch Ryan surprise Dr. Walt. Then you'll see Dr. Guy, the dentist, make an impression on Ryan's teeth. And watch Ryan leave quite an impression on Dr. Guy. And in my office, you'll see if Ryan needs glasses. And if he does, wait until you see how much fun he has picking them out. So let's go meet Ryan.
Lindsay, do you know how a doctor fixes a broken arm? No, neither do I. Corey, you know how an eye doctor tells if you need glasses? No, I don't either. Ryan, do you know how a dentist can see right through your teeth? No, neither do I. Ryan, you sure ask a lot of questions. But we don't know the answers. Well, today I'm going to find out those answers because today I'm going to the doctor.
Hi, Ryan. It's good to see you again. Come on in. First, let's see how much you weigh, Ryan. Wow, 350 pounds. What's going on, Ryan?
Well, maybe it's all the stuff in my pocket.
Ryan, what do you have in there? A bowling ball?
Well, yeah.
Wow.
And my tennis racket. And my basketball. And my baseball bat. And my football. And my soccer ball. And my phone. And my bike helmet. And a rose from my mom.
Nice shorts, Ryan. Where'd you get those?
My mom got them.
Do you know what this instrument is, Ryan? No. It's called a stethoscope. I listen to your heart and lungs with it. Let's listen here. Your heart sounds great. Now I want you to take a deep breath in and out. Very good. And one more time. And your lungs sound great also. Now I'm going to check your stomach, Ryan. Let's see how it feels. I just want to make sure everything inside is the size it should be. Let's check your reflexes now, Ryan. This is a rubber hammer, and I'm just going to tap you on the knee. Now we're going to look at your eyes with this light to make sure they line up properly and make sure the pupils react normally. And then we'll use the otoscope to check the ears to make sure they're healthy. And then we'll use the tongue blade to make sure the mouth and teeth are also healthy. Very good, Ryan. Ryan, an important part of your physical is when we watch you walk. Why don't you walk down the hall for me? Okay. By walking and watching you walk, we can see how your arms, and hips and feet work together. That's very good. Ryan, you are very healthy today, but sometimes you may come in here with some problems, and I'll always be here for you. I'll always be here for you. I'll always be here for you. I'll always be here for you.
Problems. 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 What does he mean by problems? Problems. Problems.
You may have an ear that is hurting. A sore throat. A stomach ache. Or a fever. Ryan, are you okay?
Yeah, I'm okay. Boy, what a dream.
I'm going to show you some things we use for children when they come in with injuries.
Oh, great, Dr. Walt.
Sometimes, Ryan, you might come in here with a cut that's too big for a Band-Aid. In that case, we'd have to use some stitches. And this is how we'd do it. We take this drape and put it over the area that's cut, and then I'd put my gloves on, just like this. And then we would take the cleaning solution and clean up the cut. And then I would numb it up. and the numbing medicine is going to feel like a pinch, but after that you won't feel anything. You won't feel the stitches and you won't feel any pain. The stitches look just like this, just like a piece of thread or a fishing line. See that? Now if I suspected a problem with one of Ryan's bones, we take him back to the x-ray room and take a picture. Here in the x-ray room we have a camera which takes the picture of the bones. But before we take a picture, we have to make sure the lead apron is in place. So we put the lead apron on and then we take the x-ray picture. And here's the x-ray, and it looks excellent. There are no fractures. Ryan, let's say you really did break your wrist. This is what we'd do. We'd take you back to the x-ray room and take the pictures. Then we'd bring you to the cast room. See these bones here in the wrist of this skeleton? This is the radius, this is the ulna. These are the bones we'd be working on. First we'd take this sock-like material and put it over your wrist. Then we'd take this padding and put it over the sock-like material. And then we'd apply the cast. Once the cast is on for a few minutes, it hardens. And then you're set. First we take the drape, put it over here, Ryan. You can put that hand down. Then we take the sock-like material and put this through here. We'll stick your thumb right through there. Great. Perfect, Ryan. Then we'll take the padding and put that on, just like this. You want to wrap it around so you have a nice soft padding there. We'll put it through the thumb. There we go. That's it there. Okay. And then we put the gloves on. Like this. Okay. Now the cast material is nice and wet, soft. We squeeze it out a little bit. Take your wrist, like that. Now we have to do this fairly quickly because it dries and hardens quickly. So we'll take this and pull it over, like that. Now if your arm really was broken, we'd put a few more layers on. And we'd let this harden. Make sure there's room for your fingers here so that you can still write if you're left-handed. And in about 2 or 3 minutes, it'll be nice and hard. When it comes time to remove the cast, we use the cast saw. And then we use the spreaders to open up the cast. We use the scissors to cut through the padding, and then we remove the cast. Good as new.
Good as new.
Ryan, you've been a great patient today.
Thank you, Dr. Walt.
Just remember, in order to stay healthy, you need to get plenty of sleep, eat a good healthy diet, and have a lot of fun exercise. Ryan, for being such a super patient today, here's this sticker, and I want you to pick something out of the treasure box.
Whoa!
Whoa!
I think someone just dropped in to get their eyes examined. No, not the frog. I think Ryan's here somewhere. But where is he?
I'm over here fishing, Dr. Pat. I'm over here fishing.
Well, come on out.
Here I am.
Hi, Ryan.
Hi, Dr. Pat.
In a moment, we're going to go back in the exam room to see what it's like to have your eyes checked. You'll see a lot of equipment back there. Plus, we'll show you how to make glasses if you need them. One of the first pieces of equipment you'll see when you come in the exam room is this thing called a phoropter. While Ryan takes a peek through here, I'm going to shine a little flashlight at him. This instrument's called a retinoscope. While I'm shining this light in his eye, I can tell if Ryan needs glasses or not. The phoropter has a lot of knobs and dials on it. And inside are a lot of lenses that help me fine-tune Ryan's vision. Ryan, which one looks more clear, the first one or the second?
The second.
All right. Can you read those letters for me now?
P-H-T-C.
That's great. If you don't know your ABCs, that's okay, because we've got pictures up there that get smaller and smaller. Ryan, can you see those pictures up there?
Yeah.
Can you tell me what they are?
A telephone, a hand, a horse, and a duck, and a white bunny.
A white bunny?
Yeah, and how do you like your shorts?
Hey, what's up, Doc?
One of the next tests we do to see how your eyes are working together is called the reindeer test. This is a depth perception test.
What does that mean?
Depth perception determines how far things are away from you. Now I want you to put on these funny looking glasses
Okay.
and take a look right at the deer here, Ryan, and pinch his nose.
Okay.
All right, great. Some children don't see the deer floating at them, and we know that they have a problem with their depth perception. Ryan's doing great. Ryan, to check your color vision, we use these big numbers hidden inside these little dots. If you can see the numbers, we know your color vision's okay. If you can't see the numbers, we know you've got some kind of color deficiency. Can you tell me what number this is?
3.
That's great, your color vision's just fine. Ryan, this instrument's called the slit lamp. It lets me take a look right at the front of your eye. I can see all the things right here, the cornea, the iris, that's the colored part of your eye. And I can look right inside the eye at the lens. Wow, this looks really good. One of the last things we use during an eye exam is this thing called an ophthalmoscope.
What'd he say?
Ophthalmoscope.
Ophthalmo what?
Ophthalmoscope.
Say what?
An ophthalmoscope. It's kind of a flashlight looking device and it lets me look right in the back of your eye. So Ryan, let me take a peek in here. Yeah, that's perfect. This lets me see the blood vessels and the optic nerve way in the back of the eye. Well, everything's still back there. Nothing's missing. Ryan really doesn't need glasses, but let's pretend he did. The next thing we'd do would be go up front and find some glasses that fit him. And boy, have I got some glasses for you. Now Ryan, those look good.
Thanks, Dr. Pat.
You want to go see how we make the lenses for them?
Yeah, sure.
Well, let's go.
Okay.
Ryan, now we're back in the lab where we make the glasses.
Well, can you show me how to make lenses for my glasses?
Sure. The first thing we do is start with a lens blank. And this has part of your prescription in it already. But we have to put it right on this instrument called a lensometer. And the lensometer helps me line up all the powers so that I can make the lenses so you can see just right. Once the dots are on here, we have to put a block on it. And I'll show you what that is. This is called a block. And the block helps us hold this lens inside this machine called an edger. And the edger will grind the lens down so it's the same shape as your frame. So we'll put it in here, and then we've got to find a pattern that's the same shape as your glasses. And here they are. These guys look familiar? Yeah, see, this thing's the same exact shape. We just put it on the edger, and then once we turn it on, it's a little noisy. That will grind the lens to the same shape as your frame. So, you ready? Okay, here we go. See the lens grinding right in there? It's cutting it to the same shape as your glasses. And when that's done, we'll take the lens out and put it right in your frame. It'll fit just right. Okay?
Okay.
Ryan, once the edge is done cutting the lens, we just take it out, and it's the same shape as your frame you picked out.
Neat, Dr. Pat.
And then we pop the lens right in the frame and tighten it up, and we've got your glasses done. I'll take the block off, and there they are right here, see? All right. Okay, Ryan, the last thing we do is adjust the glasses and make sure they fit just right. Hey, those look great.
Thanks, Dr. Pat. These feel great.
Ryan, how you doing?
Hi, Dr. Guy.
Good to see ya. Come on back. We're going to have a lot of fun. I'm going to check your teeth and your gums, make sure you don't have any cavities. Would you like to see the No Cavity Club first?
Yeah, sure.
Come on back. Ryan, you see anybody you know?
Yeah, there's John and there's Gina.
Well, you know, you can join the club if you don't have any cavities. Once a month, we have a drawing to see who wins a gift certificate to the toy store. Then, once a year, we have a drawing to see who wins a grand prize. You want to join?
Yeah, sure.
Great! Well, let's go see if you can join, but first, how about going for a ride in the dental chair?
Okay.
Ryan, you want to go for a ride in the chair now?
Yeah, sure.
Okay.
Wow! Ride 'em, Ryan!
Ryan usually doesn't go that fast. Ryan, I'd like to count your teeth now, okay? Can I show you how I do it?
Yeah.
This is my mirror. Can you see yourself?
Yeah.
Great. And this is my tooth counter. Let me see your thumb. Can you feel that?
Yeah.
It tickles, doesn't it?
Yep, sure does.
Okay, let's look in your mouth. Open real wide. Great, Ryan. Boy, it looks like you've been brushing real good. Ryan, to make sure that you don't have any cavities between your teeth or tooth bugs, let's take some x-rays. I'm going to put this heavy blanket on to protect you from the x-rays, but then we'll be able to see what's going on in between your teeth, all right?
All right.
Great. Ryan, this is our tooth camera. This is our tooth film. I want you to bite down right here and hold real still until you hear the birdie tweet. Okay?
Okay.
Open big. Bite together. Look straight ahead. Hold real still until you hear the birdie. Ryan, these are your front teeth, the bottoms. These are your front teeth, the tops. These are your back teeth. Hey, and the good news is I don't see any cavities. You can join the No Cavity Club.
Yeah.
All right. Ryan, you don't really have any bugs in your teeth, but if you did, you'd want to know how to fix them, right?
Right.
May I show you how we do it?
Yeah, sure.
This is Mrs. Rumble.
That tickles.
It does, doesn't it?
Yeah.
And this is Mr. Whistle.
That tickles too. What are these, Dr. Guy?
That's a good question, Ryan. This is my air, and this is my water on the other button. And together, they make a spray, so we can rinse your mouth out. This is my reverse straw. Close your lips. See how we can get dirt and debris out of your mouth? Mm-hmm. Open wide. And this is our vacuum cleaner. Open wide.
Vacuum cleaner? Uh-oh!
Nice shorts, Ryan! Where'd you get those?
My mom got them for me.
What'd you think of that, Ryan?
Wow.
Would you like to see another way we can take pictures of your teeth?
Yeah, sure.
We can put you on that TV right there.
Oh no,
and blow
him
your
again?
teeth up 20 times bigger than they normally are.
Oh, come on. How are you going to do that?
I need your help. Can you help me?
Yeah.
What I want you to do, this is like a TV automatic remote. I want you to press that capture button when I tell you to, okay?
Okay.
Now open real wide. Okay, can you press it? Beautiful. Press it again. And one more time. Fantastic. Now we need to get a picture of your teeth. I'm going to put something in your mouth that's going to show me all of your teeth, okay?
Okay.
This is called a cheek retractor. Open real wide. It doesn't hurt. Now bite together. How's that feel?
Good.
Great. You look great. Let's get a picture. Ryan, if you had bugs in your teeth, we'd want to fix them, right?
Right.
To do that, sometimes we give kids space gas or nitrous oxide to make you more comfortable. Let me show you. Look straight ahead. I'm not going to really give you the gas, but I just want you to breathe through this nose piece. Are you getting air?
Yeah.
That's pretty neat, isn't it? Okay, let's take it off. Fortunately, you don't need to use that because you don't have any bugs in your teeth.
Okay.
Ryan, to help you avoid cavities, we have a special fluoride treatment. I've got some right in this cup, which I want you to swish around in your mouth for 1 minute and then spit into that cup.
Okay.
Nice shot, Ryan.
Ryan, sometimes we take molds or impressions of your teeth so that if you had a missing tooth, we could make a retainer so your adult teeth have room to come in. This is an impression tray that we're going to put a gelatin in. We're going to place it in your mouth and leave it for about 3 minutes, okay?
Okay.
Ryan, can you see which teeth have cavities?
Yeah, that one and that one.
What I'm going to show you is how a silver filling goes in this tooth and a white filling goes in this tooth.
Okay.
That machine mixes the silver. We place it in that special well. Then we fill this instrument with the silver so that we can carry it to the tooth. We're going to push it in the tooth like this. Then we pack the cavity. And then next what we'll do is we'll carve it again so that it looks like a tooth. How's that?
Neat.
Ryan, to do white fillings, we take this white material, squeeze it into the tooth, pat it in, and then we cure it. Look through that orange shield. Ryan, remember the mold that we took of your teeth?
Yeah.
Well, I'm going to show you how we pour it up in stone so that we can make it look like your teeth do.
Okay.
Let's add some water to the stone. Okay, we'll mix it up. Then we'll vibrate it to get the bubbles out. Now we're going to add the plaster to the impression. Okay, let's let it set. Ryan, you did great. You didn't have any cavities.
Thank you, Dr. Guy.
You want to take your picture and put it on the No Cavity Club?
Yeah, sure.
Okay, stay right there. Say cheese.
Cheese.
We'll put this up and then we'll see you again in 6 months.
Ryan, how was your day at the doctor's? It was great. It was fun. You mean going to the doctor's was actually fun? Yeah. So what'd you learn? I learned how they fix a broken arm, and I learned how they can tell if you need glasses, and I learned how they can see through your teeth. You know, guys, they're big, but they're not tough.
Another nice shot, Ryan.
Nice shorts, guys. Where'd you get them?
Your mom got them for us.
you, Dad.
I love you too, Ryan. Oh, yeah. Oh, yeah.
I can put tears in my eyes.